Hi everyone, welcome back to my YouTube channel. Today we are going to talk about the anatomy of the thoracoabdominal diaphragm and the diaphragmatic hernias. Here I have drawn the anterior view of the diaphragm, right? So here you can see the sternum, here the scaphoid process, and both sides you can see I have drawn the rib cage, right? In posteriorly the vertebral column is there. Actually this area we have the lumbar vertebrae, right? So in red color structure you can see the diaphragm, right? Diaphragm has two domes, mainly right and left. Okay, so here in anterior view you can see this right dome and the left dome, right? Right dome and the left dome you can see, right? And also you can see this esophageal hiatus, aorta, aortic hiatus, and right crus and left crus. Actually these structures we are going to talk about properly, talk more in next diagram, right? And now in the next diagram we will talk about the inside view, right? Inside view of the diaphragm, right? So inside view means if the person is like this, if we cut the person in horizontal plane in the level of diaphragm, and we are going to look from below. Okay, we are going to look from below. So this is that view. This is the inside view of the diaphragm, right? Inside view of the diaphragm. So what is this margin? This is the margin of the diaphragm which give rise to the diaphragm, right? That is the inferior thoracic aperture. What is inferior thoracic aperture means? That is the lowermost margin of the thoracic cavity which contains anteriorly scaphoid process, and here the 7th to 10th costal cartilages, okay, and here 11th and 12th ribs, and posteriorly the lumbar vertebrae. Okay, so from the inner surface of the inferior thoracic aperture, diaphragmatic muscles are arising, right? And the arised muscles are runs upward and join with the central tendon, right? Runs upward means here like this, like this, like this, like this, like this, okay, coming upward and join here in the central tendon. Okay, here it's a central tendon, like, okay, hope you understood that. So now we will talk about the parts of the diaphragm. According to the origin, there are three parts of the diaphragm as lumbar, costal, and the sternal, right? Lumbar, costal, and the sternal. First of all, we will talk about the lumbar part of the diaphragm, right? Lumbar part is the strongest part of the diaphragm, okay? Strongest part of the diaphragm. So here there are main important things in the lumbar part: crus and two types of ligaments, okay? Crus and two types of ligaments. Crus there are right and left, right and left. Actually left crus is starting somewhat upward than the right crus, okay? Right crus is coming downward, okay? Left crus is coming means arising, okay? Arising somewhat uh, downward than the left crus, okay? And here this screws are attaching the diaphragm to the vertebra, okay? Attaching the diaphragm to the vertebra, okay? And the other one is the ligaments, okay? Two types of ligaments are there: medial arcuate ligament and lateral arcuate ligament. Medial arcuate ligament, lateral arcuate ligament. This medial arcuate ligament is in the level of in between the bodies of the L1 and L2 vertebrae. Here this is the level of uh, vertebral bodies, right? This is the L1, this is L2, right? So L1 and L2 vertebral bodies are there. In between those two vertebral bodies, that level is the level of inferior margin of the actually we are saying the level of the just the level of the medial arcuate ligament. See, I'll show you here from this side medial arcuate ligament. Okay, now we are in the same level. We are just stretching the line. So now in the in between the vertebral bodies L1 and L2, now again the medial arcuate ligament, same level, right? Same line. Okay, and this medial arcuate ligament is above the pons major muscle. This one, pons major muscle, right? So also the pons minor muscle is above the pons major muscle, but we are talking about the pons major muscle mainly. This is the lateral arcuate ligament. It's in the level of 12th rib and it's above the quadratus lumborum muscle, right? Quadratus lumborum muscle. This lateral arcuate ligament is very important place, okay? Very important structure. We will talk about that later also in several names, okay? So okay, so that's the basic structure about the lumbar part of the diaphragm. Okay, now we will talk about the costal part of the diaphragm. Costal part of the diaphragm is arising from the inner surface of the costal cartilages from 7 to 10th ribs. Okay, and also from the inner surfaces of the 11th to 12th ribs. Okay, so these muscles arising from those areas and those parts and runs upward, as I told before, and join with the central tendon. Also this muscle, okay, this costal part of the diaphragm is continuing with the first slip of the transversus abdominis muscle. It's just extra knowledge, it's not that much important here. Okay, so next we will talk about the sternal part, that is the smallest part of the diaphragm. Okay, it has a very small short several slits. Okay, several short muscular slits. Okay, which are arising from the posterior surface of the scaphoid process and going upward and join with the central tendon, right? So that about the sternal part. So now we talked about the all three parts of the diaphragm, right? And next you can see here also, you can see, right, I will draw like this. I will draw like this just to show you more clearly. Those yellow areas, yellow triangular areas, we call as sternocostal triangles. Okay, right and left sternocostal triangles. Why? It means those triangles are in between the sternal and costal areas, right? Sternal and costal parts. So sternocostal triangle, sternocostal triangle here, which we call as lateral arcuate ligament, also in between the lumbar and costal areas, right? Lumbar and costal parts, right? So that also in between two parts of the diaphragm. So that because of that we call this as lumbar costal triangle also, lumbar costal triangle also. Okay, that's why I told you before that this place as this structure has so many names, right? So that's about the structures. Okay, and now we will talk about the uh, openings. Before that I will show you the note about the attachment of the diaphragm here. Attachment of the diaphragm. Okay, so whole circumference of the inferior thoracic aperture give a rise to the muscular parts of the diaphragm. Actually the inner surface of it give a rise. Okay, a lumbar part is arising from the L1 L4 vertebrae, the cruce especially. Okay, and the arcuate ligaments also there, medial and lateral, right? Then costal part arising from the inner surfaces of the costal cartilages of the 7th and 10th ribs, and inner surfaces of the 11th to 11th and 12th ribs, right? And sternal part is arising from the posterior surface of the scaphoid process. Okay, I just noted it, okay, to make you clear, right? And here now we will talk about the openings of the already present openings of the diaphragm, right? Here I have drawn the aorta. Here I have drawn the aorta, right? Aorta is coming from the aortic hiatus. Aorta is coming from the aortic hiatus. This aortic hiatus has surrounded by a tendinous band. Okay, tendinous band. Here the whitish area which I have drawn is the tendinous band around the aortic hiatus. Why there is a tendinous band means because diaphragm is a muscular structure which support into the breathing process, right? So diaphragm is very important in our breathing process. It's contracting in inspiration, right? So due to that, due to the muscular contractions of the diaphragm, this aorta can be compressed, right? Aorta can be compressed, right? So to prevent that, we have a tendinous band around the aortic hiatus, right? To prevent the compression of the aorta due to muscular contractions of the diaphragm, we have a tendinous band around the aortic hiatus, right? So that's it. So not only the aorta, thoracic duct also coming from the aortic hiatus. It's coming posterior to the aorta. This one, right? This one, right? Okay, so then next structure is the esophageal hiatus. Esophageal hiatus is not surrounded by a tendinous band. Okay, okay, it's not surrounded by a tendinous band. Actually muscular parts are there, muscles are there around the esophageal hiatus, and those muscles works at functioning as a sphincter, okay, which controls the food passage from the esophagus to the stomach, right? It functioning as a sphincter, right? Muscular sphincter. Not only the esophagus, also two vagus nerves. Okay, two vagus nerves are passing from the esophageal hiatus, and also esophageal arteries are coming along the esophagus. Okay, throughout the esophageal hiatus. The next one is the inferior vena cava. Inferior vena cava, inferior opening for the inferior vena cava. It's actually situated in the central tendon, so we don't want a special tendinous band around it because it's already present in a tendinous part, right? So there will be no compression to the vein, right? So the inferior vena cava is coming from this, and the right phrenic nerve also passing through the opening to the inferior vena cava, right? Then where is the left phrenic nerve? Left phrenic nerve is just coming from the central tendon like this, right? That is left phrenic nerve, and these right and left phrenic nerves are innervating the diaphragm, right? Okay, so these three foramens are the main foramens, main openings which are present in the diaphragm. Other than that, there are some small openings, small narrow openings to some structures. Okay, uh, so those structures are sympathetic trunk, greater and lesser splanchnic nerves, and azygous and hemiazygous nerves. Okay, so I will just draw and show you the syncope of that. Okay, how those are passing like, then you can take an idea about that, right? So this is the vertebra, right? This is the vertebra, and this is the diaphragm. This is the diaphragm. Okay, now I will draw the aorta like this. Okay, never mind about this quickly drawing. Okay, and here I will draw the azygous and hemiazygous in orange color, right? And the sympathetic trunk in yellow color. Okay, and the greater splanchnic and lesser splanchnic, greater splanchnic and lesser splanchnic nerves. Okay, so those structures are passing from the diaphragm to the below, right? Passing downward. So this is the syncope. Okay, so you can see these all structures are very close to the aorta, right? Very close to the aorta, right? Okay, the right side is the azygous, this is the hemiazygous, right? So what I want to show you is these structures are very close to the aorta. So some people are telling that these structures are also passing through the aortic hiatus, but it's not. They have some special, like they have special narrow openings for them. Okay, especially for them, right? So it's like that. So if this is the aorta, azygous will be go like this, hemiazygous will be go like this, and sympathetic trunk will become like this, sympathetic trunk here, and the splanchnic nerves will be come in between the hemiazygous and sympathetic trunk in right side, and hemiazygous and sympathetic trunk in left side, right? So like that, there will be narrow openings also there, right? So I will just show you the note for the openings, right? Here, structures passing through the diaphragmatic openings, right? So aortic hiatus is giving the aorta and the thoracic duct, and esophageal hiatus is giving esophagus, two vagus nerves, esophageal arteries, and foramen for inferior vena cava is giving inferior vena cava and right phrenic nerve, and small narrow openings which I told just now are giving the splanchnic nerves, actually greater and lesser both splanchnic nerves, and the sympathetic trunk, azygous vein, and hemiazygous vein, right? So now we will talk about the weak places of the diaphragm, right? Weak places of the diaphragm, right? What are the weak places? As I told before, this place has so many names. Actually, this is a weak place also. So when we're talking about the weak places, this part, which this structure we call as slit of Bodelac, right? Slit of Bodelac, slit of Bodelac, right? So left and right both we have slit of Bodelacs, and here the sternocostal triangles also we call as slit of Morgagni. Here actually right side we call as slit of Morgagni, and left side we call as slit of Larry. Slit of Larry. Some are telling both as slit of Morgagni, doesn't matter, but actually it has a special name as slit of Larry. Okay, slit of Larry. Okay, so and the other one is this slit of Bodelac has communicated. Actually, it's very close to the capsule of the adrenal gland and the kidney. Here I have drawn the adrenal gland, kidney and the capsule of it. Okay, it's very close. This capsule is very close to the slit of Borderlac. Okay, it's very important point, right? Now we will talk about the hernias, right? Here there is a chart. Okay, there's a chart about the hernias. Diaphragmatic hernias we can divide into congenital and the acquired. Congenital hernias are Borderlac, Morgagni, and congenital hiatal hernias, and also central tendon hernias, right? Borderlac, Morgagni, and congenital hiatal hernias are the main, and central tendon also there, but those three are the main. Acquired hernias are hiatal hernias and traumatic hernias. Actually, the naturally occurring one is hiatal hernias, and traumatic ones are the hernias which are occurring due to trauma to the diaphragm, right? Now we will see what are the congenital diaphragmatic hernias. So here, this is the same this picture but in the embryo, right? So here, in embryonic period of ours, right, these yellow color things are foramens. Okay, what are these yellow color? Here, just compare. Here the slit of Borderlac, this also the same, but these are foramens, right? Actually these are not in circular structure, these are foramens. Just I have drawn in circular just to mention you properly, right? And here this in adult, this in infant, right? Here you can see that I have drawn in different sizes, because in this side, the right side, the herniation is less in probability, right? In Borderlac hernias in less in probability in right side, more common in left side. Actually 80% of the Borderlac hernias are in left side. Okay, left side, right? That's why I draw a big circle in left side and small one in right side, right? And in Morgagni hernias, actually, although I told you that in left side we call as slit of Larry, but in hernias we call both as Morgagni hernias. But the right side is more common one. Right side is more common, right? Central tendon hernias also can develop because of the developmental problem of the central tendon, right? These are also actually due to developmental problems, and also in embryonic period these are actually communicating through with the abdominal cavity and the and the thoracic cavity, right? These are help to communicate with the abdominal cavity and the thoracic cavity. So when there is a pressure difference, okay, pressure difference in the abdominal cavity and the thoracic cavity, the organs can be herniate to the thoracic cavity. So that's why hernias are occurring, right? So here, and also the other one is hiatal hernias. Hiatal hernias means it's the throughout the esophageal hiatus, the organs, abdominal organs can pass to the thoracic cavity, which are more common in adults, right? So those are the congenital hernias, right? And here, acquired hernias. Acquiredly, actually I have mentioned the acquired hiatal hernias, because traumatic hernias we can't say a specific position, because where the trauma is, the place which is going to be a herniation, right? So if the trauma is going to be happen near to the aorta, then there can be herniation near to the aorta, like that. Okay, we can't say a specific position of that. Acquired hiatal hernias means as I told in the congenital hernias, that is in through the esophageal hiatus, that is through the esophageal hiatus. So this is the normal structure of the esophagus and the diaphragm and stomach and all, right? So here the esophagus, stomach, and red color structure is diaphragm, and the dark color lining below the red color structure is peritoneum, right? Here normally the esophagus, 2 centimeters of the esophagus is below the diaphragm, and I have drawn some strips here. Actually there are no strips there, I just have mentioned it just to show you clearly. That is the gastroesophageal junction, right? That's the gastroesophageal junction. See, it's below the diaphragm, right? It's the stomach, right? So this is the normal position. There are 4 types of hiatal hernias, okay? 2 of them are main, but we will talk about all 4, right? Now we will talk about the first type. It also called as sliding hernia. What has happened means the cardiac part of the stomach and the part of the esophagus which was below the diaphragm has slided upward, right, from the esophageal hiatus, right? So the gastroesophageal junction also has gone upward, right? So due to that, because of this gastroesophageal junction is in upward, this patient has gastroesophageal reflux, right? So this is the sliding hernia, and also you can see the peritoneum is in the normal position. It has not gone upward, so this hernia don't have a sac. This is a sackless hernia, right? So we can call it as sackless hernia, pseudo hernia, false hernia, right, like that. And the type 2 hernia also we call as rolling hernia, because this fundal part of the stomach is sliding upward from the esophageal hiatus, besides of the esophagus. Okay, so here you can see here the dark color I have mentioned. I have make it dark just to see you clearly. Okay, because I have drawn here somewhat mistakenly, because I here the gastroesophageal junction should be in the same position as in the normal one. Okay, because it's not going upward. Okay, it should be here, but here mistakenly I have drawn somewhat upward. It should be here, it should be here. And the slided the rolled the fundal part of the stomach has gone upward besides of the esophagus from the esophageal hiatus, right? So this is rolling hernia, and due to the gastroesophageal junction is in the same position, these patients don't have gastroesophageal reflux. Okay, and here this is the third type. Third type means the combination of the first and second types of hernias. Okay, so here you can see mistakenly I couldn't tell you about the peritoneum, right? So here you can see the peritoneum has gone upward with the fundus of the stomach, right? So that means this hernia has a sac. So this is a true hernia. If the hernia has a sac, that means it's a true hernia, which don't have here. This is a sackless hernia. This is a hernia with a sac. So this is a pseudo hernia, false hernia. This is a true hernia, right? And here this is as I told before, this is a combination of the first and second hernias. So gastroesophageal reflux also there, because gastroesophageal junction has gone upward and cardial part has slided and fundal has rolled upward, right? Fundal part has a peritoneum, but this part don't have, right? And the type 4 is actually it's due to the so many organs coming through the esophageal hiatus, stomach, intestines, mesenteries, and all are coming to the thoracic cavity from the esophageal hiatus. But it can be two types. One type, the gastroesophageal junction can be remain in the same position. Okay, but in other one, gastroesophageal junction has gone upward. So in here this patient has gastroesophageal reflux and this patient don't have. So that's about the anatomy of the diaphragm and also the diaphragmatic hernias. Thank you so much for joining with me.